super excited, and I love the ecosystem. Matt, we stumbled across and met each other
Yes.
at the water cooler at one of these other conferences, and here you are.
It's an honor and a pleasure to be here. You know, the beautiful thing about healthcare is it brings people who share a passion
Yes, it does.
and a mission and a vocation
Absolutely.
to make a difference.
That's
and you know, that energy,
Exactly.
positive people bring positive energy.
That's right.
And that's what we need more of.
Absolutely.
You know?
That's right.
So it's great.
And
And-
Robert?
And Robert, so good to have you.
Yeah.
Happy to be here
Yeah.
as well. I've been coming to HIMSS for probably about 15 years now.
Exactly.
And just quickly introduce yourself for the audience.
So I'm Robert Nieves. I am a nurse by profession.
Okay.
And I've been a nurse for about 34 years. And I've gone into the informatics field about 20 years ago. With my main driver, like all of us, is how do we improve healthcare? And more recently, this is how we connected. I've had a healthcare, so I've been in the patient side of
Right.
things, which really gives you a whole different perspective.
Exactly.
And why
Absolutely.
we need to do what we need to do.
That's right.
Matt,
great.
will you introduce yourself?
Sure, Matt Dobski, and I've been a lifelong healthcare
Right.
professional. That's been my vocation,
Right.
doing it from startups to, you know, large companies.
Exactly.
And so I serve in a capacity of really connecting people
Right.
and organizations to solve problems.
Wonderful.
And I have the honor of working with Edifex
Exactly.
to take that interoperability
Mhm.
and bringing together the payer side
Sure.
and sharing that insight on the provider side.
Wow. So
So there's
that's a huge chasm to overcome. And we were talking to another organization earlier. You kind of acting like Switzerland, right?
Yeah.
How you bring these two opposing groups together to collaborate and find joint value in the information that they both are generating.
you said the word collaboration.
Collaborate. Mhm.
And that's, we need more of that.
Absolutely.
You can get focused in a silo.
Exactly.
You're not going to get out of that.
That's right. We're all in this thing together. And
Yeah.
if we don't all solve it together, we're all going to go down together.
Yeah.
All right.
It's again solving very complex problems.
That's right.
Business needs. I had the honor when I was with a prior company
Sure.
to work prior to COVID
Right.
to integrate the telehealth solution into one of the largest EMR
Right.
providers out there.
Exactly.
And it was not easy.
No.
But at the end of that journey, I was recognized out of
Right.
2,600 global
Oh,
partners
That's great.
as the collaborative partner of the year. And that meant a lot to me because it was
Absolutely.
bringing teams together, not knowing that COVID was going to hit
Sure.
2 months later.
Right.
And that now makes, again, that's the difference.
That's
we
right.
might, in our day-to-day world, we might not save a life,
Right.
but what we do makes a
Contributes to it.
difference to saving many lives.
Absolutely. Absolutely.
Well, and I think, there's collaboration certainly across
Right.
vendors,
Right.
partners, that type of thing.
All right.
But the patient aspect of it is so critical.
That's right.
Because we're all going to be patients
One day.
one day,
All right. If we haven't already.
sooner or later.
That's
Exactly.
right. Yeah, exactly.
And so it's that combination, from a collaboration perspective,
That's right.
is how we need to change, really
That's right.
transform
Yeah.
our healthcare world.
That's right.
And that's what we need more of, I believe, with that
So-
mentality.
So just drill down a little bit more in what your company does and what problems are you solving for the industry now?
Yeah. So I work for Elsevier,
Mhm.
and we are a publisher. We're the largest healthcare, life sciences related content publisher in the world.
Right.
So many of the clinicians, doctors, nurses, allied health professionals use our books, journals during school,
Sure.
and beyond. A lot of the journals we
Right.
publish. So we publish knowledge, content. right?
Exactly.
Is what we do. Some of our solutions are integrated into the daily workflows of the clinicians. So there's a set of solutions that
Right,
we
right.
provide around that, but it's all related to how to bring the best practices, that information to the clinicians to make better decisions.
Right.
In a nutshell. So
Makes sense.
when we talk about knowledge, right, and really we talk about empathy, right? in the end,
Right.
It's about people. It's really about knowledgeable empathy, right?
That's
It's
right.
making the right decisions with the information that you have. in order to take care of those patients. So that's in a nutshell what we do.
Okay, that's great.
And bringing that from a content perspective,
Sure.
that while being one of the largest publishing companies, that Elsevier
Right.
global clinical publishing companies, content unused is useless content.
Right,
So
right.
it's getting it
That's a good point.
integrated into the workflow.
That's correct.
And that's it. Make it accessible
Sure.
at the point of care
Right,
without creating more white noise.
absolutely. And is that the problem you're helping to solve?
Well, there's always a problem to solve.
Right.
EdFX, on the other hand, EdFX does
Right,
something
right.
that's uniquely
Right.
different. It's aggregating all that data.
Oh,
So
okay.
EDI transactions, right?
Right.
That's in the name
Exactly.
of EdFX, and done a great job of unifying that data and
Sure.
streamlining that data. But no one ever said, "I want to create an EDI gateway when they were a kid."
Right, right.
You want to be a doctor, or a police officer, or an
Right.
astronaut,
Right, exactly.
professional athlete.
Right.
But it's what we do. If we don't make that data flow
Mhm.
and get it to the right person at the right time, bad care outcomes
Absolutely.
can occur. Patient surgical procedures
Mhm.
can't be performed when they need to,
Mhm.
and the level of acuity increases.
Exactly.
Or the surgery gets postponed because prior authorization hasn't got.
That's
We
right.
solve those problems. We create that efficiency
Mhm.
so that while the objective is improved clinical outcomes,
Sure.
it also results in improved financial
Oh,
outcomes.
absolutely.
Put money back into the bank of the
Mhm.
health systems.
Makes sense.
We
Makes
need
sense.
that.
Yeah, and I think in today's world, there's so much information out there,
Mhm.
both good and bad.
Right, right.
And we need to have content that is, from a trusted source, from reputable,
Sure.
so that you can base your decisions
That's right.
on those and not on whatever is out there floating.
Exactly.
Yeah.
And that's the challenge that,
Right.
that we have nowadays.
Absolutely.
We have access to a lot of information, but not all of it is accurate. Right?
Yeah.
So I'm curious with content because you have the providers, the clinicians, empowering them, but then also the caregiver, the family. Tell us a little bit about that, because those are. I mean, I imagine that's a magic to totally engage patient engagement, provider engagement.
Absolutely. And there's about informing the doctors, informing the nurses, but also informing the patients.
Yeah,
Right?
yeah.
And so our solutions are cut across those.
Mm-hmm.
But organizations really need to look at how to implement that and get that to the patients.
Okay.
And I was just a patient for 21 days.
Right.
Mm.
The education was really bad, right?
Mm.
And it was a very high-level, reputable hospital that I was
Sure.
at. But it wasn't for me looking for the information. Luckily, I'm a clinician. My wife, is very intense about my care.
Right.
We would not have gotten the information that we needed, right? And we're making a lot of our decisions
Sure.
as patients, right? So it needs to be all three things, right?
Yeah.
Every clinician and the patients be informed so that you can
Right.
decide on what's the best course for you, which is, the
Yes.
patient-centered care really at the bottom.
Michael,
Exactly.
that's a great question, because I think that's an important part of
Mhm.
healthcare that's missing, is engaging in the consumer,
Yeah.
the person who's receiving care,
That's
the
right.
patient, right?
Absolutely.
They have to take part in accountability in their care
And,
outcomes
and
as well.
advocating for their care.
Yes, exactly.
Right.
And it's not easy.
That's
How do you
right.
change behavior? So you probably went through this through your personal care. It's understanding. How do you change behavior?
Mhm.
Increasing awareness and
Mhm.
understanding, and then confidence and
That's right.
belief to then sustain a behavior that
That's
is
right.
going to result in a good outcome.
That's right.
We need more of that. Healthcare won't change if we're just putting all the pressures on the provider
Mhm.
or the payer.
Right.
We need to get the person involved too, and the families and the caregivers.
Oh, absolutely.
One, the way that I saw it too is that I was lucky that I had my clinical background.
Yeah.
That's right.
But I kept imagining, what is that? That person that doesn't,
Yeah.
and they don't have anyone.
It's so funny. The previous guest before you joined just wrote a book on that,
Yeah.
and they were both insiders in healthcare, and they were also both cancer survivors, and they talked about their own challenges and frustrations in navigating the healthcare system as an insider.
Exactly.
So to your point, can imagine what people who have no knowledge of the system,
Yeah,
how they deal with it.
I can
Yeah.
imagine it.
Yes.
I was sitting there in my bed going, oh
Right.
my God.
Right.
What if I didn't have
That's right.
Or my wife, who was
Was it-
also.
that's right.
'cause at one point, I wasn't even able to take care of myself.
Mm.
And it's not just about here's a pamphlet on this condition.
Right.
When you have a situation where it's very complex, things are changing day to day,
Exactly.
and you have to keep informed, right? What limitations, what tests you're doing, etc. It's, it's
To be
crazy.
overwhelming, yeah.
It's very overwhelming.
Absolutely, yeah.
And so we need to think about all those things. But it's not just about the task of doing it, right? Which that's where we live currently.
That's
For
right.
A number of different reasons, but we
Exactly.
got to change that.
And
That's why I say knowledgeable empathy, right?
Right.
It has to be.
Yes.
Well, all healthcare is personal when it
That's
comes
right.
down to it, right? And what you're doing here at HIMSS this week is really important
Oh,
because it's
thank you.
it's sharing information
Thank you.
and increasing that openness. Let's
Let's talk about these
let's
things.
talk about it.
Right,
We've
let's talk
got
about the good,
to talk
bad, and
about
ugly
it.
of it. Yes.
And there's certain
Right.
stigmas that are assigned
Yes,
with
right.
things. Let's remove the
That's right,
mask.
absolutely.
Let's say we can do
This
better.
thing is broken. Yeah,
Yes.
let's fix it.
Well,
And
Right.
it's really easy to make somebody else the bad, right?
Right.
yeah,
But I have to say that my clinicians, the teams
Yeah.
that worked with me were amazing.
Right.
yeah.
But there was a issue with knowledge consistency
Right.
across.
Exactly.
That's what we need to look
Yeah.
at.
Yeah.
That's right.
It's not there was no malintention on their end
Yeah.
at all. I could understand it.
Right.
Just seeing and observing their day to day. It's like I don't know how you operate, right?
Absolutely.
Yeah.
And that's where the
Right.
impact needs to be.
Exactly.
Spend more time, at least, from
That's
my
right.
perspective now with a different bent
Absolutely.
than I had.
So as we sort of wrap it up, any sort of takeaways for people out there from HIMSS that you guys would like to just share?
I mean, I think from my perspective, the biggest thing is that, technology is wonderful. It does help. But at the end of the day, you have to look at how do you really transform it. It's a buzzword, I know, but how do you transform practice, make it lived? How do you we were just talking about evangelizing
Right.
everyone in this aspect of it, right? Because that's what it's going to take. I don't care what technology you have. Not cool from that perspective, it just won't work.
Wonderful.
I've been coming to HIMSS for a long
Yeah.
time.
Yeah.
And, while there's a lot of great opportunities to reconnect with colleagues,
Right.
one of the things that I always has been impactful about HIMSS and other conferences like HIMSS is the opportunity to start a conversation. And change starts with that
That's right.
conversation.
Absolutely.
And we need more of that. And the companies, listening is a big part of that conversation.
That's right.
We have to do more of that. This
Right.
is a great venue for that.
It is.
And it's naturally curious minds want to know and learn new things. It's a great opportunity for that at HIMSS.
That's great.
So much to learn.
Yes, it is.
So grateful for all you guys do
No, we're
as
grateful
well.
for what you guys are doing as well. Thanks for taking time out your busy schedule to have this conversation with my colleague and I. And we wish you guys continued success and enjoy the rest of the conference.
Thank you very much.
Absolutely.
Appreciate it.
Yeah.